So I see a number of patients that will come to me after a major weight loss, and oftentimes that can be the result of diet changes and lifestyle. I've had patients that on their own have lost up to 150 pounds. But more often than not, I do see patients that have had some type of bariatric procedure, such as a gastric bypass or a gastric sleeve or even a lap band. And in those bariatric procedures, patients will lose a significant amount of weight over a shorter period of time. So they may lose up to 100 pounds in 12 to 16 months, so it's really rapid weight loss. And as they lose that weight, their body goes through a tremendous amount of changes and the skin doesn't always keep up with the weight loss. And that's where I can come in to help remove extra skin, reposition tissue, and really kind of help create lifelong changes for patients. I consider it the skin removal surgery, the next phase in their weight loss journey. Depending on how much weight a patient loses, they may have extra skin in their arms that make them a candidate for brachioplasty. They may have a significant amount of skin loss in their thighs that would make them a candidate for a thigh lift or a thigh-plasty. And thigh-plasties can be done in basically two ways. It just depends on how much loose skin there is. So for a traditional thigh lift, the incision is made in the crease of the thigh, right where kind of the torso and the leg comes off of the torso, right in the crease where your bikini or your undergarment would go. The nice thing about that is the scar is relatively hidden. It can be camouflaged in a bathing suit or boy shorts or things of that nature. The downside to that scar is that it really is good for patients that just have a little bit of looseness of skin in the upper third of their thigh. So if I have a patient that has skin that hangs all the way down to their knee, they're probably a better candidate for a procedure or an extended thigh lift. That's where I take the incision all the way down the length of the inside of the thigh and extends all the way to the knee. That's a longer incision, so potentially more visible. Will correct the extra skin along the entire length of the leg. After a major weight loss, patients will often present with extra skin of the abdomen. Traditional abdominoplasty involves an incision from hip bone to hip bone, and I'll remove the redundant skin and fatty tissue that's between the pubic hairline and the belly button. In addition, I will tighten the abdominal wall muscle that may have separated after a major weight gain or weight loss and pregnancy. So during pregnancy, we all start off with paired rectus muscles, and those are the muscles that are the six packs. And over the course of a pregnancy, those muscles will separate to accommodate the growing uterus. And sometimes those muscles come back together and sometimes they don't. And so after a pregnancy, that can contribute to the floppiness or the poochiness of the abdominal wall. So with a abdominoplasty, I'm going to tighten the abdominal wall muscles and bring those back together to make a tighter, more toned abdominal wall. With patients who've had a major weight loss, I might find that they have a lot of redundant skin both hanging in the bottom but also in the upper abdomen. And in those situations, I may recommend what's called a fleur-de-lis abdominoplasty. And that's basically where the skin removal is marked as a fleur-de-lis, or as a French kind of design of a flower. You think about the New Orleans Saints, it's that design on their helmet. And I create the skin removal pattern in the fleur-de-lis, and it closes as a vertical incision and a horizontal incision, or an upside down T. That type of abdominoplasty is reserved for patients who have a significant amount of weight loss and a lot of redundant skin, and don't object to a visible scar down the entire length of their abdomen. But it can be a very powerful procedure in helping to reshape the body after a major weight loss. For patients who've had a major weight loss, oftentimes they have extra skin in many different areas of their body. There are a lot of different options that I can use to help remove that extra skin and help contour their body after weight loss.